More than 100,000 students below the age of 15 years in Kenya are living with HIV, and most of them were born positive. These children are being brought up in an unfavorable environment that lacks supporting structures both at home and in school. In this video, we'll hear the voices of HIV positive students telling us about their experiences in schools and how they wish teachers, administrations, and fellow students would do things differently.
And I've been longing to meet with that teacher and tell them like, hey, mimi niko na hiyo virusi na mbona sikai hivyo venye ulikuwa unasema.
Slogan that used to say HIV and AIDS is a terrorist.
Wenye inaweza niwa haraka ni stigma.
Sure, because they think there's no right person to tell. All the teachers shall be judged for any wrong they do to the kids.
Most of the children who were born with HIV do not get to know their status until they reach puberty. As you would imagine, this is a defining moment in their lives.
Awkward. I felt awkward, like it was the beginning of my desolation. Like the whole world's going to desolate from me. I'm going to be alone. Nobody's gonna love me. That's how I felt. I had friends by then, and most of them never liked those people. Never liked them. Those people with HIV and AIDS, even the teachers. We had one funny teacher. All her comedies were concerning all those people with HIV and AIDS.
I knew my status when I was in class 7, 13 years old. That's why I knew my status. So I was brought back in the clinic, the counselors. They told me, do you know what you're suffering from? But I told them that I had a chest pain. So they told me that's obvious. So I want to tell you now that you are positive. I couldn't believe it. At first, my mind was not there. So my mom told me on my face that you are positive. So the counselor advised me. By then I cried at length. I never knew that. I knew that I was alone. How could it get in me, but not my sister, my brother, and yet I have my small brother, and it is not in him.
Nilikuwa nikiuliza mamangu, mbona mimi naendanga hospitali na kunywa madawa? Ananiambia ataniambia. Mimi nikakujanga kila siku nikitoka clinic namuuliza hivyo. Hakuanga akiniambia. Mimi one day nikiwa hospitali December last year ndio date 2 in Thika level 5 kulikuwa na let's say nika party. Tukaenda huko lakini ilikuwa party ya watu wako HIV positive. Adolescents wakaitwa kando, tukaanza kuongeleshewa. Tuongeleshewa hapo ndipo nilijua status.
Najua I saw nimefika the end of the world. Hakuna future. But like let's say nilikuja kujitikia nikiwa class 7 that time. Cause niliona saa hakuna otherwise. Hata nikijikata I'll die. Hakuna otherwise, so I have to live positively. Then nika join support group. So nikaona kuna watu wengi wenye wako the same na mimi.
We sat down with the counselor and she first of all read me a verse I'll never forget. That is in Isaiah 43, where you are told even if you pass through fires or waters, I will always be there with you. So then she told me that my mom passed because of she was positive. At first I was shocked, but then I was curious to know what about me. So she told me that I am HIV positive, and because I knew there is HIV and there is AIDS, so I asked her, now, is it I have HIV or I have AIDS? She told me, no, you have HIV. I remember that I laughed and I said, thank you, Jesus. Yeah, she was shocked because she didn't expect any reaction like that. So she asked me why, and then I told her, I know one thing, HIV is manageable, but AIDS, it's like you have reached to a point where even the medicine cannot do, because you have already acquired and all those diseases. Yeah. So from there henceforth, I never had a problem with my status at all. Actually, what I have struggled to accept is my loss of sight.
There are many teachers across the country who do not know if any of their current or past students are HIV positive. As the head of the National AIDS and STI Control Program, NASCOP, Dr. Martin Sirengo tells us, it is important for schools to be sensitive on how to handle those living with HIV.
The challenge we've had with the implementation of HIV among the young people, especially learners, is that a lot of the children on treatment are taking medicines and yet they do not know why they're taking those medicines. So the issue of disclosure is very key. For learners who are in boarding schools, they do not have a safe space to be able to take their medications, get appointments to go to the schools, largely because the school environment is not supportive. One of the reasons for that is because the teachers may not know the status of the children, and therefore that provides a barrier to the children being able to access the much needed services. Teachers in schools may not have the necessary skills to be able to support the learners, and that's why as NASCOP we have put together training materials to be able to capacity build teachers together with the Minister of Education, so that they can provide the right interventions for their learners.
It is important to look at HIV from a global context as a development issue. That is why UNESCO is involved in this capacity building exercise for teachers.
HIV and AIDS is not just a health problem, it's a development problem. And where you have young people, or where you have resistance, where you have denial, it's difficult to really tackle this issue. But we know that there are lots of young people living with HIV and AIDS not very positively. And the idea is to live with it positively, because when you live with it positively, you do not hide what your condition is, and by so doing, you educate others. Outside Africa, there has really not been much of that problem. We've had experience, for instance, in Canada, where there's been a lot of peer health education, and living positively with it is really a contribution to also overcoming some of the development issues.
Back to the students living with HIV. What experiences do they go through in school?
My first day when I went to Form 1, we sat down with my stepmother and my elder siblings. Now they were asking me, now we know we are leaving you to other people's hands. So are you comfortable for us maybe to tell them you have a problem, so that just in case anything happens to you, they can alert us. We managed to speak to the school principal, and she was like, hiyo ni life, okay. Hata kuna wengine hapa wengi sana wako na hiyo ugonjwa, usidhani utakufa. And she was speaking that in a very loud tone, not knowing that maybe hata kama huyu mwingine anasema maybe amepita hapo nje. So akasema it's okay, atakuwa tu sawa nini. But there was one of the days that I was supposed to come for my appointments, and I went to her to ask for permission. And then akaniambia hakuna kitu kama hiyo, there is no way you're going. Nyinyi ndio wale watu mnaenda mnauza madawa huko nje nini. So I didn't come for my appointment that day. I had to source for a telephone from the school cooks to call my parents so that they can call the principal to confirm to her, to tell her that I was not going home to do anything illegal. I was just coming for my appointment. So for that particular day, I also didn't take my medication because my appointment day had reached. Sikuwa na dawa, principal amekataa nikuje nyumbani niende hosi.
I never had that courage to tell anyone. No teacher, no friend. Besides the school that I was learning, it was very, very, like we used to be given this like reports, maybe parents meeting, and then at the far end there was a slogan that used to say HIV and AIDS is a terrorist, it kills, stay with your family. So that made me so afraid. And hata singeweza ambia mtu, even the teacher, because if the slogan is I'm a terrorist, and maybe hata naweza fukuzwa kwa shule, naweza ambia you have it, we don't want anyone else to suffer, so just stay, search for another school or something else.
In school, they say that HIV kills, especially where I learn in Homa Bay, say that country, people have ukimwi. Watu wako na ukimwi mingi, so they fear it. But ukijulikana, people will fear you also. So it's in private, so people don't know that I have. Maybe there are some people who have in the school, but they have kept from themselves. But only me, I'm the only one who I can see in the dorm that I'm taking the medicine, but people don't know why.
Mwalimu mwenye niliambia ni head teacher peke yake na deputy. Mwaka wa 2006 mimi niliwaambia, kaambia akaniitikia, sababu niliona siwezi kaa hivyo juu nikiweza kosa kwenda, kama nimeendea madawa, kesho yake nitaulizwa. Hata kama nikikosa kwenda shule, anatumana jua ama niko nyumbani ama niko wapi. Kaa siku nyingine nilikuwa mgonjwa na sikuwa nimemwambia mami ni mgonjwa, akaa nyumbani, akanitumania, nikakutwa nyumbani, akasema niende, nikaenda, nikamwelezea hivi na hivi na hivi, aniambia sawa, ndio ukakaa nyumbani, ukipona utarudi.
My auntie had to sit with the head teacher, the principal, and tell her everything, disclose everything to her, and she accepted. By that time I was taking a special diet, so the principal said the school cannot do that just for me, so instead I can be carrying milk, UHT. So I entered school, and my medicine were kept with the nurse. We have a nurse, we have a dispensary there. The matron knew, the nurse knew, and they were very supportive.
The school administration keep to its word that if it is Teacher's Tower taking care of a certain boy or girl in her class that is HIV positive, I should keep the confidentiality of that child unless maybe the child is willing to disclose.
I've been in a boarding school and a day school and living with HIV because it was challenging to me since I never saw any teacher who was friendly, and as a lady back then I never knew how to socialize. I was very quiet in school, so all the teachers, I just saw them as teachers, not as a friend or a sister or a mom. So I took it personal in boarding school until when I came out of that school to a day school, where I found a teacher who was very maybe supportive, if I say. But to me, she wasn't, because at the end of it all, she went out disclosing what I told her to the rest of the kids, which was so harming to me afterwards, which also caused me to fail my drugs. That one I can say it was the cause of the teacher, because if she hadn't disclosed to the other teachers, I could gain that courage, and I could know I have someone who is supporting me.
One of the greatest challenges in the fight against HIV and AIDS is the stigma.
For me, kitu yenye inaweza niwa haraka ni stigma. If you tell me that if you have HIV, there is no future for you, kasi sina knowledge, itaweka kwa mind, and I'll say, by there is no future.
Sana hapo form 3, form 2 hapo mwisho. Wasikia watu wanaanza, umeza drugs, kwani uko na ukimwi nini? Cheki vile amekonda. Kwani they reach a point that hadi kuna moja niambia Elvis manze umekonda siku hizi, kwani nini ni mbaya, kwani uko na ukimwi? Niambia ni anemia tu ndio inanisumbua. But then I just said it, but deep inside I felt that pain, that how comes, kwani washa realize nimeanza kukonda, kwani nimeanza kushow signs. za HIV AIDS, how comes? Yeah, that's all. So I never wanted to tell them due to fear of stigmatization and also the slogan of the school.
Actually, I had this interaction with one of them who got tired of what people were talking about her and all this, and she took all her ARVs and tried to commit suicide. She took all the bottles of her ARVs. So I went to talk to her and I asked her what's the problem and all that, and she told me, yeah, watu venye wanaongea, mi imefika point I don't see the essence of living. Ni heri tu mimi nikufe niwaachane nayo. So I spoke to her, even gave her hope, nikamwambia, hey, look at me, I'm taking my meds, sijaambia watu and all that. I was keeping my medication for myself in my sanduku box zile zetu za shule.
The stigma is really, I believe, the real problem, both from those who are infected and those who are affected and those who interact with them, and especially with young people who would have really contracted this at through birth. You cannot really blame yourself, and you cannot also bring up young people to blame their parents, because like we said, it could be through a number of reasons, and not to just the way we negatively look at it, that it is promiscuity that creates this. It could be a number of reasons, and because of those reasons we have to look at saving lives rather than being castigating an individual or criticizing or creating a situation of difficulty for the person to live happily. And where you have stigma, you have more casualties, and therefore the importance for teachers to understand that in the work they're doing, they are saving lives, and they are also helping that child to learn to be able to contribute. But if really they take on a negative stance, they're not helping in development.
Normally, even as teachers, sometimes when we are teaching them like a song, we are teaching a song that is going to stigmatize. We are not teaching a song that is going to tell us that this is something within us and we need to see what to do. So the children look at it as if it is something that is going to kill them and finish them, and therefore they have a negative attitude about it. So it's not really to the side of assisting those who are positive, such that as they expound on it as a killer, it even makes those that are positive afraid.
HIV doesn't kill. What kills, it's you.
One of the greatest challenges in the fight against HIV and AIDS is the stigma. From what the children have said, it is clearly very important for teachers to be in the forefront of fighting stigma, supporting HIV-positive learners, debunking myths, and spreading awareness about HIV. It calls for collaborative efforts between all bodies concerned, especially the Ministries of Health and Education.
The Ministry of Health should partner with the education so that whatever the Ministry of Education helps should be in position to get down to the particular school where that child is, so that the administration can know that in this school, even if we go to our schools right now, I would wish that we have where you can go enter a school and ask the principal or the head teacher, how many children do you have at 1,000? How many are positive? It becomes part of us, that we just accept it. It's within our life that I have 10 children who are HIV positive, and so. That is now to the head teacher without mentioning maybe whatever the names of the children. So the Ministry of Health should begin, get information to us, if possible, come to our schools and even give talks to the other learners to accept any learner in their school who may be living positively, so that we all have a good working atmosphere for all of us.
After the training, our expectation is that we are going to have a continuous engagement with teachers. By way of direct communication with the teachers, we will also develop a tool to be able to speak to teachers in terms of getting personal responses about their experiences dealing with HIV in schools, what are the difficulties that they go through, and then on a continuous basis improve on some of those challenges that are picked. By doing that, we believe we are going to have a solid partnership to help our learners to lead a normal life in schools.
And finally, Here's a personal message to you teachers from your students.
Take them as your own, guide them and counsel them to reduce the stigma thing that is going on, because that is the thing that brings us who are victimized, the self-esteem to go down. And the moment the self-esteem goes down, we don't take the medicine, and it is bad. We need the medicine to keep us going. It doesn't mean that we have a death sentence when we have the HIV. Having groups sitting down doesn't have to be a guidance and counseling teacher. You can do that. It is possible. And we live a happy Kenya. We reduce the digits that are going high every now and then. They will go down. Because if one school does that, have that mentor group, and the other does the same, the whole county does the same, then at the end of the day, the rest of the country will be safe and will be AIDS-free country.
Treat the HIV positive students like one of your own. Treat them equally, because they are also human. Don't neglect them, treat them fairly.
HIV does not determine the person or that child who he will be. You as a teacher, guide the child right, protect his or her rights, because also as living with HIV, we also have our rights. And these rights are to stay like any other child and not to be tortured by anyone or even anything in this world. And we also want to live in a country that is free from stigma and discrimination. And this stigma, if we start me and you, it will end in our country.
Whenever you are in this life, remember, you have one opportunity to live. And every moment you spend, you shall be encountered with it. Have a positive attitude for a positive 100 life. The term attitude, account to 100, because letter A, number 1, you go on. So when you have a positive attitude, you are amounting to 100% advantage to a life or a better life. And again, when you live, please have a motto. Don't live just like that. Have a motto to yourself. Like I do have a motto to myself, that I will live to inspire before I expire. And I hope you do your work as the way God wants you. Remember, in the Bible, all the teachers shall be judged for any wrong they do to the kids.
Somalia, Morocco, Namibia, Angola, DRC. Well, ladies and gentlemen, we agreed that no child should be born with HIV in Africa. But this is only possible if we join our hands together to fight this dreaded disease. Primary prevention is a must for all of us. So each one of us must know his or her HIV status. Family planning is available, even for the HIV positive individuals. When you get pregnant and you have HIV, you can still make a choice and go to the hospitals and get antiretrovirals. If you take them well, I know that the child will be born HIV-free. Men, remember to take your wives to the hospital so that you can support them and make a joint effort to support the baby too. When we do this, we know that we shall have an HIV-free generation. Let's go!